boots off before it starts because I'm too hot. Nobody can see my feet. Okay. So. Unlike Bonnie Henry with her shoes.
Yaffe.
I'm as ready as I'll be.
Hi everyone, we're going to get started now. It's just going to be Dr. Yaffe today. 30 minutes, one question, one follow-up. I'll turn it over to Dr. Yaffe for some remarks.
Thanks very much. So good afternoon, everybody. Dr. Williams had an urgent meeting of the command table this afternoon, and he's unable to be with us. I'm going to offer a few brief remarks before highlighting the numbers for today and then open it up for questions. I want to begin again by thanking all Ontarians. Thank you for continuing to practice physical distancing, for staying home as much as possible, and only going out for essentials. As we head into the weekend and temperatures are expected to rise, remember that these actions are protecting you, your loved ones, and those most vulnerable in your community. I want to especially thank our essential workers for keeping Ontarians safe, healthy, and fed. And of course, our healthcare workers. I do want to especially acknowledge the difficult time you are going through, particularly with the report that a second healthcare worker has now died in Ontario. Know that your sacrifices and dedication are not going unnoticed. And to the families and friends of all Ontarians who have died from COVID-19, we offer our deepest condolences. So, as of 4 p.m. yesterday, in our integrated public health information system, we have a total of 9,525 confirmed cases of COVID-19 in Ontario. This represents an increase of 564 cases from the previous report. And again, women are exceeding men. 56.5% are female, 43% are 60 years of age and older, and 55.5% are people who live in the Greater Toronto Area. We've had a total of 478 deaths reported. This is an increase of 55 deaths from our previous report. We are aware of 106 outbreaks reported in long-term care homes, with 216 deaths reported among residents. We continue to see the number of resolved cases going up, which is good. So we're now at 4,556 cases, representing 48%, almost half of all cases resolved. The number of healthcare workers who have tested positive is 1,068, or 11% of cases. This is a cumulative number and does not represent the number currently positive. We have 829 cases currently in hospital. Of those, 245 are in ICU. That number has gone down slightly, and the number on ventilators is 200. That has not changed. In terms of laboratory testing, at this point we have in Ontario done 136,992 tests for COVID-19. And we have almost 6,000 currently under investigation. In the last 24 hours, 8,899, basically almost 8,900 tests have been completed in the last 24 hours, which is almost the same as yesterday, which was 9,001. And the percent positivity in our tests is staying around 10%. In fact, it's going slightly down. The other thing I did want to mention before opening it up is that the modelers are expected to present an update on modeling for Ontario on Monday. So with that, I'll open it up for questions. Thank you.
Okay, we'll go to the phone lines.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Dr. Yaffe. We spoke with the Ontario Medical Association today, who's raising concerns about a second wave of patients going into Ontario hospitals once the pandemic passes. Now, these are patients that have had their chemotherapy delayed, surgeries to remove cancerous tumors delayed, glaucoma, laser surgery delayed, and they're worried that there isn't a plan in place to get these patients the treatment they need as quickly as possible, and that there's also not a plan in place of all these patients going into the hospitals and collapsing the system. So as far as you know it, has there been any discussions about what happens after this pandemic and how we're going to get these patients the treatment they need as quickly as possible?
That's a very important question, and there are starting to be early conversations, certainly about how are we going to very slowly and carefully ramp back on the measures that are in place, while also ramping up on procedures that have been held back and are important for those people to get done. There have been conversations at the Special Advisory Committee of the Federal, Provincial, Territorial Group that with the chief medical officers around starting to look at what should we look at? What are the factors that should be considered when you start to ramp back? And also conversations certainly at the provincial level with different bodies around how are we going to address the ramping back, and also keeping in mind that there very well may be a second wave, and how do we prepare for that? So whatever's done has to be done extremely carefully, and we have to measure what's happening and make sure that we don't do anything too quickly that will cause it to go right back, and we could have a severe outbreak. So it's very much an item of discussion. There's no clear answer at this point.
Follow-up?
And my follow-up question, we're also hearing from doctors that visits to the ER have plummeted. There are people suffering from chest pains, extremely low blood pressure, extremely high blood pressure, or displaying what could be signs of a stroke, and they're actually choosing to ride it out at home in fear of going to the hospital and contracting COVID-19. So do you think it's time that maybe a message goes out across the province telling people that it is safe to go to hospitals?
Well, certainly I think people should not hesitate to go to the hospital if it's an emergency. And if they're in doubt, they should call telehealth or their primary care provider to get advice. But if somebody's having chest pain or a potential stroke, for sure it's way safer to go to the hospital than stay at home. I know that there is some concern, and certainly people know that in hospitals sometimes you can be exposed to infections. But of course, we know COVID-19 is being transmitted in the community as well. So I think they should do whatever's best for their own health and not be concerned. If they need to go to the hospital, they should be going to the hospital.
Next question.
Your next question comes from Travis Darraj with Global News. Please go ahead.
Hi there, Doctor. Good afternoon. I know that you mentioned that projections are going to be released on Monday, and I know that more specifics will come, but in general, I'm just wondering if you can tell us whether or not things are looking better or worse, and what advice in general has the command table given the Premier based on the new projections?
Is it looking better or worse? I would say it's generally looking better, but of course we now see that our numbers of cases are going up and the number of deaths. So we are not out of the woods. We have to keep doing what we're doing and monitoring. And so we'll have to see what the modelers come up with. Obviously, they have been given the most accurate and up-to-date numbers, and everybody's doing their bit to make sure that we're not spreading it. But I can't really speak to what the command table's advising the Premier, but I know there are lots of conversations happening Certainly a lot of focus now on long-term care and retirement homes and other congregate settings where we know that the infections are still they're still happening, and there are issues that need to be addressed.
Follow up?
And the Premier was asked about what parents should plan for as well. He said that he wasn't given any advice from yourself or Dr. Williams that the school year should resume before the end of June. What would you tell parents right now, and what advice has been given to the Premier on the potential of opening up schools before the end of June?
I don't believe any specific advice has been given. I'm not aware of any. It's one of the factors that's certainly being considered. We have a public health measures table chaired by Dr. David McEwen that has Public Health Ontario and some local medical officers and experts on it that are considering what measures can be loosened and in what order. So one of them, of course, is to look at the school year. And, I think that part of it is looking at what is the evidence around transmission by children. Obviously, it's important for people to get back to work, for children to be going to school. However, it's also important to consider what factors do the children play in the transmission of the illness. So I think that's part of looking at the literature and the evidence around that, and also looking at the economic impact. So there's a lot of factors that have to be considered.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Dr. Yaffe. Yesterday, Dr. Williams broke out in the numbers of new cases. How many were in long-term care residents? As he said, that has been a growing percentage of new cases. I'm hoping you can tell us how many of the 564 new cases are in long-term care residents, and how many of the 55 new deaths.
It's funny you asked that, because I was just looking at the data before and discussing it with some other people, because ideally we need to be able to tell how many are exactly from long-term care in the cases and the deaths and so on. And it's not as simple as it should be in terms of the data. There are different databases, and the database that we use for reporting is from IFIS, as I mentioned, Integrated Public Health Information System. The Ministry of Long-Term Care has a separate database that the numbers are slightly different. And the outbreak numbers in IFIS include all the deaths that are attributed to the outbreak, including the lab-confirmed outbreak cases and the epidemiologically linked cases. And we can't match it up without going back to the actual records, which would be extremely work-intensive. So I'll tell you what I estimate to be, but I can't really tell you accurately because of that, and it's something we're continuing to look at. How do we make the data better? There's always problems when you're looking at data and different information systems. So my estimate is from the 564 confirmed cases, about 334 are from long-term care and 230 are from community. And the number in community is going down. But again, you have to take that with a grain of salt, because they are coming from different databases and may not be accurate. But that is an estimate.
Follow up?
Do you have any information on the number of deaths? I understand with the caveat. I know looking in the epidemiological summary that's online, it shows an increase in long-term care deaths of 54 over yesterday. But so does that mean it's not necessarily that 54 of the 55 new deaths are in long-term care? You're saying they're counted differently?
You're completely correct in that. So I can't say for sure there are 54 of the 55 are from long-term care.
Next question. Next. Can you take yourself off mute if you're able to?
Sure. Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. wondering, just following up on what Allison was asking there. So, how come we could get an answer on, like, Dr.
I'm sorry, Rob, can you speak into the phone?
Sorry, can you hear me now?
Yes, please go ahead.
Okay, sorry. I'm just a bit puzzled, and I'm not trying to be critical. I'm just trying to figure this out. So you gave us a rough number there on Allison's question on the number of cases from long-term care. And yesterday, Dr. Williams gave us a number of deaths, but you don't have a number of deaths today. So was he estimating yesterday?
I assume he was. I wasn't here, but that's my assumption. There are two different databases, and, I mean...
Rob, go ahead.
Its own database. And Christine Elliott said she's developing one as well, or the province is developing one well. Can you just go a bit deeper into the shortcomings with the provincial databases?
You're very muffled. Can you repeat it?
Okay, sorry. My phone must be acting up. Can you hear me now?
It's a bit better.
Okay. How's this?
Better.
Okay. Can you get into more detail on what the problems are with the provincial database? I know Christine Elliott today said they're looking at improving it. So what more do you need out of this?
Well, I think on a go-forward basis it will be clearer because now that we changed the policy a few weeks ago, I guess, where if there's an outbreak in a long-term care facility, even with one case, we are testing everybody who's symptomatic and, in fact, close contacts who are asymptomatic, so they'll all be tested. So we won't have the category of epidemiologically linked cases to contend with, and that will help a lot. But on a retrospective basis, it's not worth the amount of work it would take to go back into the charts to rectify the numbers.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Dr. Yaffe, is the expansion of testing into some much higher volume, like potentially tens of thousands of tests per day, is that a necessary precondition for any of the planning on reducing the current restrictions?
I would say yes. I think there are a number of things that we need to have in place, and we need to have a good handle on what's happening with the infection in the community and in facilities. So that's why we need more testing. We also need to be able to identify cases as soon as possible so that public health can ensure that they're isolated quickly and that contacts are identified and advised quickly so that we can stop the spread or prevent the further spread of the infection. So in order to do that, we do need good testing and we need increased capacity, which is exactly what's happening.
Follow up?
Well, to that point, though, I mean, the province has struggled to get its testing levels up to even what we were told the nominal capacity is, and nobody has publicly discussed any measures to get testing up above between 13 and 15,000 tests per day. I mean, if we realistically need to be talking about 20 or even 30,000 tests per day, what is the path to get there?
My understanding is we're aiming to get to around 18 or 19,000 tests a day. And then we'll see. As we go along, we'll see if we need more. And certainly right now, we are doing some special testing in about 20 or so long-term care facilities and retirement homes that have outbreaks. We're testing all the residents and staff to see if there's any evidence of asymptomatic infection that could be of concern. And so these are the kinds of things we're looking at right now, and they will help determine if we should do more testing or if we'll be okay with the 18 or 19,000, which is, I believe, the goal.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hello, Dr. Yaffe. I was speaking with a PSW on the phone today who goes into homes, up to 8 homes a day of different seniors, elderly residents. And he was telling me that his agency has only given him 10 masks to last 1 month. In your opinion, is that adequate PPE for these workers?
Actually, we were just having a conversation today with a senior official that's in charge of home care or deals with home care. And it's obviously very important that these staff have adequate PPE. The issue to date has been that with the limited supply of PPE, it has been prioritized to acute care and now to long-term care and retirement homes. So I think the next sector that needs to be addressed more comprehensively is the community, and that includes home care. So I think obviously 10 masks for a whole month is not very good, but I understand there are issues that I think that person should talk to the agency they work for and ask for more masks, and in the meantime try to preserve the mask as possible if it's not soiled, and possibly use a cloth mask if they run out of masks. But they should be speaking to their agency.
Follow-up?
Okay, thank you. Thank you, they have. My other question is about ventilators. Do you have numbers on the survival rate for people in this province who actually go on the ventilators? I know from the numbers today they're the same. They haven't changed, but I believe they've gone down the odd time, and I'm just wondering, is it because they got better or because they passed away?
I actually don't have that data in terms of whether the people. I don't have that data, but that's an interesting question.
Next question.
Your next question comes from Phil Perkins with HCHC News. Please go ahead.
CH News, that's okay. So obviously, we've increased the testing across the province, and we're seeing positive cases with that going up. Is that just pulling back the curtain on just how bad this really is, since that we're now testing more people?
Well, we are testing more people. It's the number that are being tested is predominantly in long-term care, not only, but the number exceeds the number in the community. So I think what we're seeing is that there, as we know, there's an issue in some long-term care retirement home facilities, which we're addressing, and less of an issue in the community. But of course, people are staying home and following public health advice, which is very good. So yeah.
Follow.
And I understand that, correct me if I'm wrong, but I think medical officers have helped. You guys have mentioned you speak with your peers across the country, right, in other provinces. It looks like BC is looking to loosen some of their restrictions in their recent projections released today. What advantages did British Columbia have into fighting this the way they did, besides their population? And is there anything that we can learn from that?
I mean, we're always sharing and learning from each other across the country. As I mentioned, the chief MOHs meet at least twice a week and have conversations and emails between, as well as with the federal government. I think it's really hard to compare provinces. I think that some of the measures they've put in place are the same measures we've put in place. We have a different population here.
Okay, next question.
Your final question comes from Mo Fahim with Vista Radio. Please go ahead. Oh, it looks like Mo has hung up. There are no further questions.